Welcome to the space between two lines. I'm Alex Saunders, and this is a space for real, honest conversations about fertility, pregnancy loss, and the journey to parenthood. Here, we hear the stories of people navigating the highs, the lows, and everything in between. A place to feel seen, understood, and less alone. Because every story matters, and so does yours. Today's guest is Imogen, who's currently navigating IVF to conceive her first baby after she and her husband discovered they were both carriers for cystic fibrosis. Her journey has been incredibly challenging, including serious complications after 2 separate egg collections that caused internal bleeding, one that required emergency surgery. With low AMH and 3 egg collections behind her, Imogen has faced the heartbreak of no viable embryos, the hope of one embryo, and is now awaiting the results of her latest round. In this episode, she shares the realities of IVF, resilience through trauma, and what it means to keep moving forward when the path to parenthood is anything but easy. Welcome to the podcast, Imi. Thank you so much for being here today.
Of course, thank you for having me.
Did you want to start by introducing yourself to our audience and just telling us what your life looks like at the moment?
Yeah, so my name's Imi, or you can call me Imogen. I'm 28 and I'm currently doing IVF with my husband because we're carriers for cystic fibrosis. So we're doing PGT-M testing and navigating IVF along the way as well.
Yeah. Okay. Before you started this whole process, and we'll dive into that, I want to take you back to when you made the decision that you did want to grow your family, what that looked like at the time, and if you did have any preconceived ideas around conception. Did you know you were a carrier at that point, or did you find that out as you moved through this journey?
So our journey to deciding to conceive was quite an interesting one because we actually spoke about having kids about 4 weeks into dating, which is very abnormal, I would say, but we always knew that we were going to have a family together, and we actually had some bumps along the road before we were ready to start trying to conceive. So I have adenomyosis and suspected endo, so I've experienced a lot of chronic pain throughout my adolescence and early 20s, and through some ultrasounds that I was doing for that, I actually found out that I had a really low ovarian reserve. So I was about 24 and I found out that I had very low ovarian reserve. So at that stage, we actually met with a fertility specialist and discussed what trying to conceive would look like for us. At this stage, we were probably about 2 years away from doing that. We were planning our wedding and kind of knew that we would start trying soon after, but we weren't there yet. So when we did decide that we were ready to start trying for our family, we sort of knew that we had a smaller window of time. We'd been indicated to kind of try for 6 months or so, and if we hadn't fallen pregnant, then go back to the fertility specialist. But I didn't know that I was a carrier. So when we did that fertility appointment, 2 years before we started trying, Medicare didn't offer the 3-gene preconception testing. It wasn't bulk billed, and so it wasn't an option for anyone that was trying to conceive unless you had a family history of someone having a genetic condition. So it really changed the trajectory when we did find out that we were carriers.
Yeah, I can imagine. Before you got to that point, when you did start trying naturally, although you already had those reproductive diagnoses, did you have quite a regular period? Were you able to time your cycles?
Yes, I was quite lucky that it was really regular. It was much more on the shorter side, so 21 to 24 days. So I had a much shorter window for ovulation, and my luteal phase was a bit shorter, but we were really lucky. And because I did get onto ovulation tracking quite early, we were very blessed that we were able to understand when I was ovulating, and, we were able to try with quite a lot of conviction that it was the right time to be trying. So yeah, we did have quite a lot of luck in that aspect of when we were trying naturally, we did have regular cycles and we were able to track it in a way that allowed us to make some good decisions of when we would try.
Yeah. Okay. And did you try for 6 months and then decide to go back to the fertility specialist, or do you want to just tell me what that period looked like for you guys?
So because of my chronic pain, I was on the pill for prevention of pain and prevention of excess estrogen, I guess. So I spoke with my GP when I went off the pill because she was wanting to monitor it quite closely to manage my pain, particularly because pain medication and pregnancy often don't go hand in hand. So we tried for about 3 to 4 months. And when I was seeing my GP, she handed me a bunch of referrals of blood tests to go get. And some of them she was like, this is really important. And then one of them was the preconception carrier screening. And because I had no family history, I sort of dismissed it, which sounds horrible now, but I was like, I'll get it done eventually. And so we were about 4 months into trying, and I finally got the test done. And then it came back that I was a carrier and that we needed to have my husband tested as well. So by that stage, it was about 5-ish months into the process. So we never kind of met those timelines that we were striving towards in the beginning.
Once your husband was tested and you found out that you were both carriers, how did you process that information at the time?
It was quite a shock. My regular GP who had referred the test was on leave. So another doctor had attempted to call to give us the result. And when they didn't get through, they just texted us the result instead, not realizing probably the implications that sharing that result would have. And we were devastated. I was very hopeful in the trying to conceive timeline. Like, I was very, very hopeful, whereas my husband's a little bit of a pessimist, and he was like, oh, we're so unlucky, it's going to happen to us if it's going to happen. But I was devastated because I really didn't think that it was going to be the case. And it's very common to be a carrier of something yourself, especially being a carrier of cystic fibrosis. It is quite common, and being autosomal recessive, which means you need both parents to be carriers for it to have an impact on future children. I just didn't think that that would be our luck. And so it was really hard to process the news, and we felt really lost after we found out that news.
Yeah, for sure. And did you at that point know what things would look like for you guys in terms of conception?
No, we didn't know what was next, because when we went in for an appointment with the GP, she kind of gave us our options, which is, you can try naturally and do an amniocentesis or a CVS when you're about 15 weeks pregnant, or you can wait and give birth and the baby can be tested then. And then she mentioned IVF and that there is something called Preimplantation Genetic Testing, but it wasn't clear for us what would make the most sense. And we were very nervous about the prospect of having to go through a pregnancy and find out that news, particularly because we didn't really understand how the cystic fibrosis would present for us with our 2 gene mutations and how that would look for the future child. So we felt really lost until we went to genetic counselling.
I could imagine that would have been a really intense conversation or period to have with your partner and making those decisions. So you sought the support of a genetic counsellor to help you make that.
Yeah, so when you do preconception carrier screening through Medicare, I don't know if this is the case for the privately funded ones, but you are offered a bulk billed genetic counselling appointment with a genetic counsellor. And for us, that was integral for us to be able to make an informed decision, because cystic fibrosis is probably something that we didn't understand with a lot of detail. We sort of knew that it's a progressive condition and that there's been a lot of advancements in care. But what we learned through genetic counselling was how our specific gene mutations would interact. And there's over 1,000 different gene mutations, and the different gene mutations impact how that person with the condition experiences life. And so we were sort of told with quite a lot of certainty that because of the ones that we carry being severe types, our child would have a very classical severe presentation of cystic fibrosis and would have multiple organs affected by the condition. Their pancreas would likely suffer, and they would have diabetes or cystic fibrosis related diabetes, and they would require daily frequent medical intervention if we proceeded to have a child that was affected by the condition, which was pretty devastating, as you can imagine. And that's what really led us to the IVF route.
Yeah, okay. So then at that point, you'd made the decision that IVF was the right choice for you guys. How did you process that?
I don't know that we processed it in the moment. I think we were very eager to get the ball moving, because I think anyone that's gone through like testing and referrals, the process is really drawn out and long. And so by the time that we met with a genetic counselor, we had found out my husband was a carrier in January and it was now the end of March. And so we found out that I was a carrier in December. And so we hadn't been trying for almost, 4 months. And it felt like a really long time. It's not thinking about where we are now, but it felt like a really long time. And so we were really eager to get the ball moving and get it rolling. And so at the time, I don't think we processed it. I think we were really just eager to get to the end and to like be able to start. And I think we had a really warped perception of what IVF would be like, even with my low ovarian reserve. Like in the genetic counseling appointment, they were pretty clear that it might not be the easiest route to take. But we were very like, la-di-da, it's going to be fine. Like, let's just get to the end of the year and I'm sure it'll all be sorted, which unfortunately hasn't ended up being the circumstance.
So did you want to talk me through what the next steps were for you guys and what information you were given around what your IVF journey was going to look like?
Yeah, so when we were looking at this process, there's only certain clinics in Western Australia that offer preimplantation genetic testing. It's not offered by all clinics. So we had about 4 that we could choose from. And because I had previously seen a fertility specialist, we decided to go with her clinic. She's the director of a clinic that offers preimplantation genetic testing. So once we decided that we would go to her, we got the referral from our GP. And from there, there's obviously big waits when it comes to seeing a fertility specialist for the first time. So I actually like booked in a nurse call and found out what are all the tests that she's going to run at that first appointment. And I just went and got the referrals from my GP. So I went and had all the bloods done. I had an expert guided ultrasound done where they were able to kind of look inside and understand the anatomy and my adenomyosis and how much it had progressed, the ovaries and the access to ovaries for IVF. And then in May, we had our first appointment with the fertility specialist, which is what kicked off the genetic PGT-M side of things, which was an incredibly long process. We didn't get our probe back, which is the test that tests your unique embryos, until I believe it was September of 2025. So it kicked off like about a 5 to 6 month process of creating our test.
Okay, so when you say probe test, that's they build a specific test like for what your gene mutation is to make sure that they can.
Yeah, so when we met with the specialist, she then referred us to do more genetic counseling with the clinic, which then they ordered for us blood tests, and they ordered tests for both us and our parents so that they could essentially create what's called a fingerprint mapping, so they can understand where you've inherited the condition from. And it allows them to better understand how the DNA might present in a future embryo. That's a part of what they call feasibility testing. So it's essentially figuring out, can we actually look at this DNA and understand whether or not it's affected or not affected? And then the probe is the test that they create specifically for you. So every person that does PGT-M, to my understanding, has a probe that's created just for them based on their specific gene mutations that allows the clinic to accurately understand if an embryo is affected or unaffected by the condition. And ours took about 12 weeks to make. It included a lab overseas and, yeah, as I said, our parents' DNA as well. And it was quite a drawn out process that we were really not prepared for. I think it was significantly longer than we thought it would be.
Yeah, it sounds like a huge process. And once they've created that probe, do they give you a percentage in terms of how confident they can be that it's effective and that they will be able to pick up the genetic condition?
Yes. So I believe it's about 99% effective, they can say with confidence. I think they always leave that 1% for any variances or things that they can't detect. But I know with the clinic that we go to, they are quite strict with the embryos that they will send off for testing. So to my understanding, sometimes when you send off embryos that have less development or they have less cells, the test can be less accurate. So our clinic, you actually can't send anything off for testing that's not a BB or above grading, which I think further increases that accuracy because they've got more cells to test and there's a little bit more confidence. But there's always that small chance.
Yeah. Okay. So it's almost been a year since you've had that original blood test. So I can imagine that you're probably quite, I know we're frustrated the right word to use, but like, ready to start the process,
Yeah.
especially when, you wanted to try, nearly a year or a year ago. What was the plan in terms of IVF for you guys? Did your fertility doctor put something together, for what the next year would look like?
Because of my low ovarian reserve, the doctor didn't really know how it was going to go for us. Because of my age, she was hopeful that I might perform better than someone with my AMH would. So we really didn't have a clear map of what would come next. And in some ways, I regret not asking more questions because I was very much just go with the flow, go to the appointments, go to the egg collection. And I sort of thought we'd be pregnant by the end of the year, and we didn't really discuss what would happen after we did that first round. It was very much wait and see. And once we did have that first round and it didn't go the way that we hoped, that's when we kind of got a little bit of a reality check of actually this is going to be a process that takes a little bit longer, and you need to really reassess what your expectations are and what comes next as well.
Yeah. Okay. And before we dive into that, did you need to have any treatment for your other reproductive diagnosis alongside IVF, or was that all okay? Or were you taking like any extra, was there medications that are needed with that or anything like that?
Yeah, so I do take a medication every day for the chronic pelvic pain, which is separate. But to my understanding, with things like adenomyosis, the treatment for it is most effective once you've done all of your stimulation cycles, because obviously IVF drugs, they really increase your estrogen levels, and estrogen is what makes adenomyosis worse, essentially. So it was kind of a case of we'll come to that once we're ready to transfer. So we didn't need to do anything in the lead up to doing stimulation cycles. We sort of were able to kick off. The only thing that we really did have to do actually is go on the pill beforehand just to ensure that I was baseline once they were ready to start the medication.
Yeah. Okay. And because of your low AMH, did your fertility doctor want you to bank some embryos before you started transfer?
Yes, she did want us to bank embryos, but again, she wasn't super specific about how many or how long that might take for us. She was very much, she didn't give anything away when we were first kind of going for our first round because she didn't know how it was going to go. So she mentioned things like banking embryos, but we didn't really understand what that meant at the time. But it was absolutely on her mind that because of my low AMH and the fact that we did want more than one child, banking embryos was probably the smartest thing for us to do, particularly because my AMH is in the first percentile for my age. So there's, a very small margin of where it can go from here as well.
Did you want to talk me through that first round of IVF and what that looked like for you guys?
Yeah, so our first round was in September. As soon as we got our probe back, we immediately started the round. Luckily, being on the pill, I was able to start, with quite a lot of confidence very quickly. So that first round was a real shock for us, I think. I didn't understand how the IVF medication would make me feel and how that increase of estrogen, and I was on a relatively high dose, I think about 300 units. So I felt quite unwell quite quickly. And unfortunately, it was really hard to process all of the milestones along the way. We went in for a scan on, I think, day 5 of injections, and we only had 3 follicles growing, which was really disheartening. And I think it was the first time that we sat and were like, okay, this is maybe not going to be as easy or as seamless as we had hoped it would be. We ended up triggering on day 9 of stims because I had just like this increasing growth. It was so quick that no other follicles could catch up, and they were sort of just like, we need to get you in for a collection to make sure that we don't lose any of these. And so we went in for a collection and we got 5 eggs, which was incredible. We were shocked that we got that many. It was something that we were completely banking on having, 3 or 2. So from collection, we were really excited again. We had a little bit of hope. And then on day 1, we got the call that out of the 5, 3 were mature and only 1 had fertilized. And that was it was just heartbreaking to hear that, especially as one of the embryos didn't even survive the insemination procedure. It was just such poor quality that it completely died as soon as they tried to inseminate. And I remember just feeling so guilty that my eggs was the problem. And we felt really, really lost because we knew that you lose embryos at every stage. And so having lost almost all of them in one day, we didn't know that we were going to have anything at the end.
That would have been really hard. What was the result of your collection?
We were incredibly lucky. The one fertilized egg turned into a day 5 embryo, which was like, I can't even describe how euphoric it felt hearing that it had made it to an embryo. We just were in awe, and we really were like, this has got to be the strongest embryo ever to survive everything else. So we were really happy. It was a good quality, so it went off for testing. But unfortunately, it came back from testing and it was not viable. It had inherited the condition from us both, and it also had multiple chromosomal abnormalities. So the embryo was never going to be viable with life. So we got that news early December. We'd done the collection on the 31st of October. So we'd had a really short kind of high where we were really happy. And then going into Christmas, we were feeling really deflated and felt really lost about how we were going to build our family and if it was even going to be possible for us.
Yeah, I can imagine, because IVF within itself, the wait times is really difficult. So I can't imagine having to wait for that testing on top of that. It would be so hard, so stressful. How long does it take for them to do the testing for you to get that information?
They tell you that it takes 4 to 6 weeks from the biopsy, which is such a long time. We have been lucky to get the results. Like in that first round, we got the results, I believe, 3 weeks after the biopsy. So one of those situations where they estimate for longer. But I know for some people that I've connected with, they have had that full 6 weeks of waiting to get their results. I feel very lucky because our doctor is one of the few doctors that will actually call you as soon as she receives the report and tell you the outcome. She won't wait for you to come in for an appointment, which has its pros and has its cons because you get the news really quickly, but you are waiting for very similar actually to the embryo wait after you do a collection. You're just waiting for that phone call and you don't know when it's coming. And when you get it, it could be the best news ever or it could be completely devastating and you kind of have no time to prepare for it.
Yeah. How did you process that, walking away from that cycle with no embryos? And then also, how was your recovery after that egg collection as well?
I had such a seamless recovery after that egg collection. I was in pain, but having a chronic pain condition in my pelvis, like I was always going to have a little bit more pain than some people. But it was really fine, the recovery. I had definitely had the hormone crash afterwards, and I felt really upset. And I think that was obviously compounded by the fact that we also got really hard news. But I think by the time that we got to day 5 and we found out that we had an embryo, I almost had this really positive extrinsic factors helping me kind of get through the hormone crash and making me feel a little bit less out of control. And when I look back at that first collection, especially knowing what I know now, it was so easy. The recovery was just so easy, and I'm really grateful that I had a seamless recovery for our first collection because I think if it had been challenging, I can only imagine it would have been much harder, particularly after getting the news that we had no embryos. I can imagine that it would have been even harder to kind of get back in and do another round.
And at what point did you decide you were ready to do another round, or did you need to have a new plan with your fertility doctor? What did that look like?
Pretty much as soon as we found out that only one embryo had fertilized, we knew we were going to go in for another round as soon as we could. With that, we did have to wait to see our doctor, and we had lots of questions, and we were, particularly because, maturity was low, but then also we'd had so many issues with fertilization. We were really unsure what the solutions would be. And I mean, I was on my soapbox, chat GPTing everything and Googling everything and just trying to understand, is it possible for us to have a better outcome than this? But when we went to that appointment with our doctor, she had created a completely new plan with a new protocol, new medication, And we were able to also do something called piezo ICSI, which is currently a trial in Western Australia, but it's a form of the ICSI procedure that is more gentle on embryos, particularly that are of a lower quality or are more fragile, which is what my embryos were noted to be. So once we had that plan, we were eager to get back in, and we actually started round 2 on New Year's Eve, just after Christmas.
Okay. And did you want to talk me through what that round looked like for you?
Yeah, so this round, in round 1, we did an antagonist protocol, so it was really quite simple in terms of the medication. For this round, we did something called an ultra short flare protocol, which is where you use the decapeptyl medication for 3 days at the start of your cycle to essentially, they call it a boost and flare. So the idea is that it flares your follicles with natural FSH and LH to hopefully have more growth. So we started off with that medication, and then we added in our stim, which that had also been increased to I think 450, which is the maximum dose you can take. And so that round, I struggled a lot with the medication. Once we got to about day 7, I was completely brain fog, headaches. I was feeling so heavy in my ovaries, but I was incredibly excited because we had recruited more follicles this time. So we had a scan that showed, I think, 8 follicles at our first scan, which was just huge, going from 3 at our first scan to having 8. So it really showed that the medication change and the protocol change worked. And then by the time that we got to collection, we had about 11 follicles. So we were really eager to get in and kind of see how many we got. And in the end, we actually woke up at a collection with 8 follicles, which was 8 eggs, sorry, which was huge. And we were really grateful.
And then what happened next?
Then it all went downhill. I woke up from collection in an extreme amount of pain. It was completely different to round 1. I'd woken up in a bit of pain that time, but this round I woke up and immediately was crying and kind of wriggling around in the bed in so much pain. And I didn't know what was going on. I felt really confused. The nurses were really lovely and really sweet, and they sort of just said, you just had more follicles collected. They've poked a lot of holes in your ovaries, so you're going to be in a little bit more pain. And so we tried to manage it with, all of the standard medications that they sort of give you post collection, but the pain didn't dissipate at all. So I was, eventually moved to recovery, where I was waiting with, unfortunately, 17, 18-year-olds that had their wisdom teeth removed. And I'm sort of just sitting on this recovery lounger, crying out in pain and feeling really scared as well, because I didn't know what was going on. At the day surgery that my clinic uses, you can't have your partners with you when you're in recovery. So I was sort of just feeling very overwhelmed, and I wasn't getting any pain relief. And we'd gotten to the point where Anissa said, I can't give you anything else. Like, you have had the maximum of everything that we can give you. And so I was sort of like, okay, I'm going to go, because I'm not with my partner. I am really, I don't know, like, I'm struggling. I don't know why I'm struggling. I don't know why I'm in so much pain. No one can tell me why I'm in so much pain. And so a gentleman made a comment before he went in for his procedure, kind of being like, oh, whatever you've given her, I don't want anything to do with that, because of how I was just in so much agony and pain. And I kind of just got to the point where I was like, I need to go home. So they discharged me, and they wrote up scripts for me to get pain medication, and sort of said, if you don't feel good in the evening, go to emergency. And off we went home. And in the car ride, I pretty much deteriorated very quickly. It's hard to explain what it was like, but I sort of describe it as like, you have these really acute flares of pain, and it's 10 out of 10 uncontrollable, and it kept happening. So we were in the car, it happened. We came home, it happened. My husband had gone to go fill my scripts, and I'd rolled over onto my side trying to kind of like find some relief, and little did I know what was happening. Immediate 10 out of 10 pain, screaming and crying. And luckily he'd walked in the door at that moment, and we were just we didn't know what to do. I'd maxed out the pain medication. I still had to wait to have my next doses. I called the nurses at the clinic, and I think they thought I was maybe going to have OHSS, being a low AMH and having a high response, like possibly because I was on, so many drugs beforehand. I think they thought maybe I was going to have OHSS, but it was presenting really soon. And so they were sort of like, just wait till your next dose. And if it hasn't kicked in after 30 minutes to an hour, then you need to go to emergency. And by 6 p.m., we were in the emergency room at our Women and Children's Hospital.
Gosh, I can't even imagine what that would have been like going through that in the beginning. Did the fertility doctor come in and speak to you after your egg collection?
No, they didn't. So I spoke to them beforehand, and then I didn't see them again afterwards. And she'd actually done my first collection, this fertility doctor. It wasn't my specialist, but she was one that works quite closely with her. And she'd done my first collection. So I almost had like quite a bit of comfortability with her. And it was strange because in the first collection, she came and spoke to me afterwards, and this one, she didn't. And so no one was really understanding the pain that I was in. And now I know and I can understand why, because what had happened to me is one of the most rare complications that you can have with an egg collection procedure. So they don't think of these things. And unfortunately, in the case of most women who do have this complication after an egg collection, you don't find out until you are deteriorating and you have passed out, you've severely lost hemoglobin, and you're pretty much requiring emergency treatment.
Gosh. Did you want to talk me through once you arrived at emergency, what that looked like and what happened next?
So we were really lucky that we'd been given the direction to go to the Women and Children's Hospital because it's not close to us necessarily, but we took that advice and we're like, okay, we'll drive a little bit further and we'll go there. Once we got there, it was busy because it's an evening in emergency. I feel like emergencies are always busy. And they were really, really kind at the triage, and they were sort of they could see how much pain I was in, and they were trying to find me a bed as soon as they could. It was pretty much one of those situations where they're bringing me back and forth into the emergency to try and do tests and to take my blood and to kind of understand before they can actually get me a bed what's happening, because it was very unusual. By the time that we had gotten a bed, it was maybe 2 hours afterwards, which wasn't bad, to be honest. I've gone to emergencies for like ovarian cyst ruptures and waited 6 hours on a chair. So I was pretty happy with that. But by that time, I was in uncontrollable pain, and they had again loaded me up with pain medication and again was having no effect. I know now because a nurse has told me, but apparently when I was in the emergency room, I was in this sort of like specialized area. Everyone in the emergency room was aware of my presence, and I was the most severe case because they had no idea what was going on. They were kind of doing pelvic exams. They were kind of feeling my abdomen. I was starting to have referred pain in my shoulder, which was when they were getting really concerned. And I essentially was a complete lost cause for them. They were at a loss of what was going on, and no one would tell me. Eventually, after about 5 hours maybe, they had gotten my bloods back. My hemoglobin was crashing, and I was very clearly losing blood somehow, somewhere. But they didn't have any ultrasound techs on night, and so they had to admit me to a ward and try and manage my pain until I could get in for an ultrasound the next morning to actually understand beyond just the, abdominal and pelvic exams what was actually going on.
How traumatic and terrifying. I can imagine that night and the wait. Were you told that you were losing blood somewhere in your body, or they didn't tell you that information?
No,
Yeah,
they
I
wouldn't tell
understand
me
that.
yeah, they told me my hemoglobin was dropping, and so I knew that, like, I didn't understand really. I'm not super like medical, and I didn't even think I knew what hemoglobin was, to be honest. But I knew that something more serious was happening, and so I was Googling and I was trying to find people on Reddit that were having this shoulder tip pain, because that was the one thing that I could determine was not normal about an egg collection. And I had heard the words hemiperitoneum, or internal bleed of the ovary, and I thought, surely not, surely not, surely not. And even to the point where once I got admitted and I was in the wards and I was off my head because I'd taken so much pain medication, but I was still in so much pain, I'd started to like convince myself that there was nothing wrong with me and that I was just having a really adverse reaction and I wasn't managing the pain well, and that they were going to kind of come and see me in the morning and tell me there's nothing wrong with you, you're just being dramatic, which luckily wasn't the case, but it was really traumatizing, particularly as I had a varied level of care from the nurses, particularly in emergency. There were some that were really kind and empathetic, and there was one that basically manhandled me and would kind of like move me around, and she was trying to transmit me to the ward. And my husband actually had to tell her, "Can you stop touching her? You're making her pain so much worse. You need to stop." And so by the time that I was in the ward, I just felt so alone and I felt really scared, but I also felt like I was dramatic and that, they don't know what's going on because there's nothing wrong and I'm just not handling this egg collection well.
Gosh, I'm glad that you went to the Women's and Children's Hospital, because that was going to be one of my questions. Like, did you feel like your pain was acknowledged in hospital? And I think a lot of the time when women come in with things like this, they can be kind of shrugged off. And not taken very seriously. So I'm glad that they did take your case seriously. But yeah, would have been an awful experience. I can't imagine how traumatic that would have been for you. So did they do a scan in the morning then?
Yeah, about 10 a.m. I was taken for a scan. And again, by this time, I'd realized like they told me you can't eat anything. And I was like, okay, seems like, they do think something's wrong, but, we'll just wait for the scan. So I went in for the scan at 10 a.m. and that was horrible. The techs were lovely, so kind and empathetic, but that scan was horrific in the pain that I was experiencing. And I remember kind of laying there, and again, I was thinking, there's nothing wrong with me. There's nothing wrong with me. Like, I'm just being dramatic. And I was trying to determine on the ultrasound screen what I could see. And I thought that I'd know what I was looking at, but I definitely didn't. And I remember not seeing anything and thinking, okay, well, there you go. You're just dramatic. There's nothing wrong with you. And obviously the text can't tell you anything, but they kept making a conscious effort to say, no, you're allowed to be in a lot of pain right now. You're allowed to be in a lot of pain. I remember they called in the person who reads the ultrasounds just to make sure they could see it in action versus just the photos. And I left that feeling a little bit validated, but very confused because I couldn't understand what I was looking at on the screen and they wouldn't tell me. But then about an hour and a half, 2 hours later, the doctors came in and told me that I'd lost about 1 liter of blood already from my right ovary. I was having a hemiperitoneum and I was on the top of the emergency list and I needed to be ready to go into surgery at any minute so that they could stop the bleed.
Oh my God, how did you feel in that moment?
Devastated and really scared. I've had surgeries before, but to be told like you're the top priority in this hospital right now to have a surgery was very confronting. And because they were rushing with time, they pretty much in the next breath sort of said, these are our options of how we stop this bleed. There's a really real chance that we will, have to stitch your ovary or, burn it or cauterize it to stop the bleed, which will impact your AMH. But there's also a really real risk that you will wake up and we've had to remove your ovary, because it's more important to us that we stop the bleed and we maintain your health than it is to keep the ovary if it's not cooperating.
Yeah, that would have been terrifying. How did the surgery look for you, and then what happened after?
So as I was getting wheeled into surgery, it was actually really interesting because I was treated with the most amazing care, which was beautiful. I went in and I felt really cared for and supported, although I was crying my eyes out the whole time. But I remember waking up and there was a group of nurses around me holding my hand. And I remember the first thing I said when I woke up was, do I still have my ovary? Did they remove it? And they were like, no, you've still got it. They took the best care with your ovary. They took their time. They've done the least invasive method they could because they knew that it was important to you to maintain your ovary. And I was just in the clouds pretty much. I didn't know what was going on or where I was, but I was in recovery for a really long time. And by the time that I really came to, I was in the acute special care ward because I required close monitoring and I required kind of one-to-one care with a nurse. just overnight to make sure that I didn't rebleed and that I was able to kind of recover from the surgery without any complications as well. So that was quite scary being in a ward like that. It was better than what they'd told me. They'd told me that I might wake up and be in a completely different hospital in the ICU. So to not be in that situation was a blessing, of course, but it was all just completely overwhelming. And by the time that I'd woken up from the surgery, it'd been 24 hours since I'd arrived at the hospital. It was the day after my egg collection. So it was really just a whirlwind.
Yeah, I can imagine. How long did you spend in hospital, and then how long was your recovery after that, both physically and mentally?
I was in hospital until the following Monday. So I spent 5 nights in hospital. I unfortunately had some separate complications to the egg collection bleed. I think when you lose a really high amount of blood, your other organs can be impacted. So my liver started to really decline while I was in hospital, and I started to have high inflammation and infection markers. So I had to stay longer than I probably would have, but I stayed for about 5 nights. Had to have close monitoring after I was discharged because I actually begged to be discharged. They wanted to keep me longer, but I wanted to get home. I recovered from because what they did was ended up being a laparoscopy. They didn't have to do a laparotomy, which a laparoscopy has a quicker recovery time, luckily. And so from the physical aspect, I would say after about 2 weeks, I felt physically better, particularly around like my abdomen and where they'd performed the surgery. My overall health was still not where it was meant to be because I'd had really high inflammation markers, I had infection, and then my liver had been impacted as well. My overall health took a little bit longer. I would say about 3 weeks afterwards, I started to feel a little bit more normal, and I'd started to get the benefits of having like a blood transfusion and an iron infusion. Those benefits started to kind of come. But the mental recovery was definitely the toughest part, and I think I'm still recovering from it, to be honest. It is something that, because it's so rare, you never anticipate when you go in for this type of procedure, and I think when you're doing IVF, you do think of an egg collection as like this tiny milestone, and it's not significant, and so I think it's something that I'll be continually mentally kind of coping and recovering for a really long time. I'm much better mentally now. I think by the time that we got to doing our next collection, I had processed a lot, but I would say it took a solid kind of month and a half, 2 months for me to feel like I could even really accept what had happened.
Yeah, which is totally understandable. Were you given any information from your fertility doctor, like as to how and why this happened and what your chances were of it potentially happening again?
They were definitely confused how it had happened. Obviously, the ovary is really vascular, and then when you add in hormone medication to make it bigger, it's really vascular again. So, the two options that I was sort of told of why this happened was either I had a bleeding disorder that I didn't know about that made me more susceptible, or that they had punctured a blood vessel during the collection, because obviously they puncture your ovary multiple times to collect follicles. Once I had seen my doctor and we'd run a bleeding disorder screening and that had kind of come back as normal, she indicated that it was likely that my ovary had a blood vessel puncture, which is very rare and shouldn't happen really because it's ultrasound guided. So they should be able to see blood vessels. But the way that it was described to me is that unfortunately, when ovaries are quite enlarged, the blood vessels sometimes are so close together that there's a really small margin of error. And I just happened to be the unlucky one where that had happened. And in terms of the likelihood of it happening again, it was really interesting because I kept joking, well, it's happened once, it's never going to happen again. And I was actually told by multiple doctors, like, you never know. The chance is pretty much the same. I think ever so slightly increased on the ovary where the bleed had happened previously. So my right ovary has a little bit higher of a chance, but it's the same chance as anybody, which is, I think it's 0.1% chance of it happening or occurrence in egg collections. So it was kind of unclear if we would actually have a smooth next egg collection or if we would have to battle this again. No one could really give me a clear answer because I think when it does come down to a puncturing of blood vessels, it's much harder to manage because it really goes down to the ovary and the person doing the procedure.
Yeah. Okay. I can imagine it would have taken a lot of courage to decide to do another transfer. We dive into that, alongside going through all of this, you still actually have the results of your egg collection that you're also dealing with. I'm sure it was probably not high priority for you, but what did that look like and what were the results?
It was so funny because I remember being in the hospital bed waiting to go for my ultrasound, and I can see the clinic calling me. And I'm just like, I don't even, not like, don't even, can't do it. So my husband got the call the day after collection. 6 eggs were mature, which was huge for us. We were really happy. 4 of them fertilized, which again, we were really happy with that, particularly because of how low our fertilization had been last time. I know for some people that might not be a great result, but for us, it really was. And then in the end, we had 3 embryos go off for testing. We had 2 day 6s and 1 day 5. And so we just felt like, as much as the collection had been so traumatizing and had obviously didn't go the way that we would hope, we felt really grateful that we had something to hold on to and that we had those embryos to hold on to, and that they kind of represented a lot more possibility than last collection when we only had the 1 off for testing. 3 weeks later, again from biopsy, we got very lucky. I was actually on a work trip in the plane about to take off, and I got the call from my doctor that we had our embryo results. And of the 3 that we had sent off, 1 had come back as viable and low risk. So we finally had 1 embryo banked. It was a mixed feeling, I think, because I couldn't help but think about the fact that we'd lost 2 embryos again. Again, we'd lost 1 to cystic fibrosis, and we'd lost another to chromosomal abnormalities that would again not be viable with life. And I remember sort of thinking, these statistics that we've been given are not shaping out to be accurate for us. And so while we were really happy to have the 1 embryo finally banked, it did feel a little bit like I still don't understand how this is going to go for us. I sort of was thinking maybe we'd get 2. And so it was again kind of like that reprocessing of, okay, we've now got 1. How do we try and get some more?
Yeah. I mean, at this point, after everything that you've been through, are you thinking like this is really unfair?
Yeah.
Yeah.
Really unfair.
Yeah.
I think I try to have a lot of perspective because I know that a lot of people go down this route. A lot of people are doing IVF, and, less obviously, a lot of people are doing PGT-M as well. But by this point, I really did feel like, when are we just going to have a win? Like, when is it going to go okay for us? And it just felt like the universe was against us in many ways. And I think for my husband as well, he really struggled to feel like we were going to get to our end goal. It became a lot harder to think about. And we both were really, really disheartened, and we felt very lost.
Yeah. Which is totally understandable. All right. So once you had made the decision and built up enough courage to go through with another egg collection, did you stay with the same fertility doctor? Do you want to let me know what that looked like for you guys?
Yeah. So we did stay with the same fertility specialist. Again, she hadn't done my collections. And so that was something that I was sort of, holding on to. But I also find her very transparent. And so that was something that I really appreciated. And I think I've appreciated the whole way. But, the fact that she was open enough to say that, this is an error, this is the specialist error. I had a lot of confidence in her. I had confidence in the protocol that she'd prescribed for us as well. And so once we had the courage to go for another round, we were really happy to go back with her because we knew that she understood how volatile the situation had been. And I think every time that we met with her, she was really empathetic to the fact that this is very different than what she expected when she first met us. I think she at the beginning thought this is not going to be that difficult, and a lot of people doing PGT-M often are sort of thought of to be an easy case in the realm of IVF because there's not sometimes any, reproductive challenges. And so, she has been very empathetic to the fact that we've had a really hard journey and that she wants to ensure that we are healthy and safe, and that we also feel supported in the decisions that we make. And so she actually offered to us if we wanted to move forward with a transfer with our one embryo. She didn't lead with doing another collection because I think she understood that maybe that wouldn't be what we would want to do, and maybe, having that complication had changed things, which I also really appreciated because she really allowed us to kind of lead the conversation and guide our next steps. And then once we kind of agreed to doing an egg collection, we joked at that appointment. She was like, I'm in it for the long haul as long as you are. As long as you want to do this, we will get you to where you need to be. And we're going to do everything that we can to keep, you safe as well. And so that was really reassuring. And I felt really supported by her, and the nurses as well were all aware of what had happened. And I, got calls to kind of say, how are you feeling and how are you mentally going leading into this round? Is there anything that we can do to make you feel more supported? And so although I had a lot of anxiety, I felt like I had all of the right people in our corner as well.
Yeah, it sounds like a really supportive system that you had there. Do you want to talk me through what your egg collection was like and after that as well?
Yes, we did the exact same protocol, and we somehow, by the grace of God, we collected 19 eggs in our third egg collection. Insane. I think at our first scan, we had between 8 to 11 follicles, and I remember just being shocked that we were having another round where we could possibly see, good egg collection results, because I'd had a bit of fear around having had a procedure on my ovary, and my right ovary is actually my overproducer. It's the one that kind of has the most follicles at every collection. So I did have this fear that, the surgery had impacted it, but we were so lucky that it hadn't. And so we did in the end have 19 eggs collected. During that egg collection, I'd actually kind of been experiencing another complication throughout my stims process. I'd started bleeding excessively throughout stims and was losing excessive blood, and there was sort of questions of like, do we cancel this cycle because my blood loss was pretty uncontrollable. But because of that, I was on medication that increases clotting and allows your blood to clot more effectively. And so I woke up from collection and I was in a lot of pain, but I was convincing myself that it was normal. And because we'd collected 19 eggs, I was like, that is why I'm in pain. Like 19 eggs collected is huge for anybody. So I was very much just sort of like, no, it's fine. I'm in a lot of pain, but it's fine. It's because I've collected 19 eggs. And I was, suspected to have OHSS. And so I was like, okay, that's what this is. I have OHSS. I have had 19 eggs collected. And so the red flags were there because, again, I was not getting any relief from the pain medication at all. It was difficult as well because I had asked for my husband to be allowed back in recovery with me because obviously it was quite traumatic last time, and they couldn't for the privacy of other patients who are also having egg collections, which I understand. And so again, I was sort of laying on these recliners feeling like, why am I in pain and no one else is? And then also wanting to not have anything wrong with me. I was so, at that point, was convincing myself that there was nothing wrong and that I was just in a regular amount of pain. Eventually, we reached the same point, which was we can't give you any more pain medication. And so I sort of was like, okay, feeling better. I want to go home now. And the next couple of days was very interesting. I kind of got home and laid on the couch. I felt okay. I started to get shoulder tip pain again. I called the clinic. But at this point, I'm kind of calling them for reassurance that there's nothing wrong, because I probably deep down know that this feels really, really painful, but I don't want to admit that there's anything wrong, and I don't want anything to be wrong. I'm just like, this is just OHSS. I'm just calling them for them to tell me that that's normal. And they're kind of telling me mixed signals. It's like, it's kind of normal, kind of not. You need to decide if you need to go to hospital. And so they prescribed OHSS medication for me to take, and I just really held on to the fact that I had OHSS, and I couldn't sleep, was sleeping upright because I couldn't lay down or move to my side. And that continued over, the collection was on a Friday, that continued all the way through the weekend. And then through kind of Sunday, Monday, it got worse again, which was scary. And then on Tuesday morning, I went back to emergency where they said that I did have OHSS, which is why the pain had worsened kind of once I'd hit that day 4 mark. But they did an ultrasound pretty much within, I think, an hour and a half of me coming to emergency. I was kind of pushed to the top of the line, went for an ultrasound, and they did find that I had hematoma on my left ovary and that I had bled from my left ovary. But luckily, because I was taking the tranexamic acid and I'd had that infused throughout my procedure, that allowed it to clot and not progress to anything more severe, which was, getting told that like my hemoglobin was dropping again and that they were rushing me for a scan in emergency was incredibly traumatizing. And I remember I just like broke down in tears and I was just so scared. But in a way, I was grateful when I found out that it was a clot and it had stopped bleeding. It was grateful, but I was also really, really traumatized at the same time. I ended up being in hospital for 3 nights. Again, I had similar complications from this round. So I had the OHSS, which was causing some complications, and I was just in a lot of pain. But because of the blood clot and the fact that there had been blood in the abdomen again, my liver was struggling. My inflammation markers were really high. I was starting to battle an infection again. So kind of while I was in hospital, I was getting lots of treatment at the same time. And at the same time as well, trying to understand, is this even viable for us to keep doing IVF at this point? Because this is my second hospital admission after 2 separate IVF, rounds, and this isn't sustainable. And no one can really tell me why this keeps happening. We found out that in the second round, I probably also had OHSS and that it was just not diagnosed because it wasn't a priority at that time. And so I remember just sort of thinking like, why is my body not able to cope with this process and why can nobody tell me why? Because I feel like I've done everything right. I've tried my best to be healthy. I've tried my best to, follow the instructions and to be moving but not moving too much and, keeping blood flow but not being, overstrenuous. And I still end up, in hospital trying to recover from a procedure that some people wake up from and they feel amazing. It was really confronting.
Yeah, I can imagine. After you left hospital, what was the conversation like with your fertility doctor? And was there any explanation? I mean, you've already kind of touched on that, but did you get any further information at that point?
We're sort of in the grey area at the moment where we haven't met with her properly, but I've had multiple phone calls with her since. She was calling quite frequently while I was in hospital. But where it sort of left off is that I do need to go see a hematologist to do some more testing on my bloods to see if there's something that isn't being identified in the bloods that my specialist is running. And my specialist has essentially sort of, her words exactly were, I don't think we can keep sticking needles into your ovaries. I'm not sure that it's sustainable anymore. So we need to kind of think about what's next from here, which we did get 6 embryos from this round that are off for testing. So we are sitting in this grey area where we hope and we pray that we get a good amount of embryos back and we don't actually need to have the conversation of doing more egg collections because we really don't know if that is sustainable or even what could be done in the future to prevent any of these things from happening.
Yeah.
It seems like a little bit unclear for everyone, so we're not sure.
Imagine it'd be a scary place to be sitting at the moment.
Yeah, it's very scary, and I think I feel really guilty as well for how I feel right now because I know that we have 6 embryos off for testing, and I think, we didn't even collect 5 eggs in our first round. So I think I feel this conflicting emotions of I'm so grateful that we have so many embryos off for testing, but at the same time, because of how unclear everything is, it feels like these embryos there's a lot riding on them, and I can't help but worry that it's not going to go the way that we hope. And I'm really, really scared because you you just don't know if it's okay to be hopeful. Like, you don't know if that's, making yourself be set up for failure by being hopeful. And that's what makes me feel guilty, because I'm sitting in this place of, I'm so grateful for the fact that we have 6 embryos off for testing. It's 6 chances, but equally at the exact same time, I don't think any number of embryos would make me feel comfortable in the position that we're at right now, because what we've learned, even from genetic testing, is that genetics are random, and the fact that we have 6 embryos is incredible, but unfortunately, it doesn't mean that any of those 6 embryos will come back as viable, because it's just so random. So we just feel like we're in a massive state of limbo right now.
Yeah. And it's so okay to have those feelings, because you've been through so much, and so much more than most people have ever had to go through when it comes to egg collection and IVF, regardless of numbers or anything like that from a medical perspective. Like, as you said, what you've been through is very, very rare, and you've been through it twice. So it's so okay to feel however you need to feel, waiting for those results. So yeah, I'm just so hopeful for you that you get a number that you're happy with, and that you're able to move forward from here.
Thank you.
Is there, coming off the back of that, is there anything that you wish people knew more about IVF in general? I guess
Gosh.
to speak about how kind of naive you were in the beginning, and you would have never anticipated going through all of these things. And I think if you haven't gone through these things or through IVF at all, there's so many things you just don't know about. And I think people just think like IVF, that's the solution, we're going to have our baby, but that's not always the case, right?
Yeah. It's such a loaded question, because I think as you said, I was really naive when I started this process, and I wish I understood how many different avenues IVF can take you. I think I knew that there were complications and that there was risks associated with doing IVF, but I never understood quite how much every woman who is doing IVF is sacrificing their body. And I think of myself as a very empathetic person, and I understood that there was the injections and that you put yourself through a lot, but I didn't understand just how much every woman and every couple who are deciding to do IVF, how much they are sacrificing from a mental perspective, from a physical perspective, and how much they are willing to do to have a family. And I think it's created for me this gratitude that I have of, I know that whenever we do have our children or our child, I know that I've done everything that I can to protect them. And, with genetic testing, I feel like I often think of this as like my first act of motherhood is me trying to protect my children and protect their health in the future. And so I wish people understood how much sacrifice there is with IVF, because without people sharing their stories and people being open about it, which no one is obligated to do, it's so vulnerable to do, people do think of it as quite a dismissive procedure, like, oh, you do IVF and you have a child, and really they forget all of the little hurdles that you go through in between, and how much you sit in a state of unease, but how much you just want your child and that you'll do everything for them. And I think it's an appreciation that I have for all women who are like on this journey, because I can't imagine doing any of these things without that deep love for a child that's not even here. And that's, really special. I don't know if that made sense, but
No, it's so well put, Imogen, and so right in everything that you've said. So thank you so much for this conversation today. And I'm so sorry for what you've been through. Is there anything else that you wanted to share before we wrap this conversation up?
I think for anyone who is listening to this and they are navigating IVF, or if they are also navigating genetic testing or PGT-M, I think I would just like to say that this process is incredibly difficult, but I truly believe that everyone walking this path and making the sacrifices, that they are mothers already. And if you ever feel like you're alone, there's so many other people that are going through it as well. So trust in your instincts that you're doing the right thing for your family and for yourself, and you'll all get there in the end.
100%. And I know you've been very open on TikTok about your journey, so we'll share that in the show notes. So if anyone wants to check in and follow along. or want to be able to listen and feel less isolated is the right word. Yeah, they can follow along with you as well, and I'll certainly be following along, and please check in. And I'm just so hopeful for you, and I hope that this round of testing comes back positively for you guys.
Thank you so much. I really appreciate being able to speak about it all.
Thanks so much, Imogen,
Thank you.
that you can share about that experience.
And you're so right. Like, I know that they don't mean anything by it at all. And I know people just don't know what to say in hard situations, but just things like, don't say to someone when you say you're going through IVF, like, that's exciting, because it really is not. If someone had a choice of going through this or conceding, and I know you got the same comments, like, it's not exciting.